nagbabalik mga kasama ang Doctors on TV. Our topic this morning, epilepsy. Let's watch this short video.
Ang epilepsy ay isang uri ng neurological disorder na kabilang sa 6 diseases of concern sa ilalim ng National Health Policy ng Department of Health mula pa noong taong 2002. Tinatayang 1% ng populasyon ng mundo ang apektado ng epilepsy at 80% o 80% nito ay naitala sa mga developing countries. Sa Pilipinas, tinatayang nasa humigit kumulang na 700,000 katao o 230 per 100,000 population ang apektado nito. Dahil dito, idineklara ng Department of Health ang unang linggo ng Setyembre bilang National Epilepsy Awareness Week. Layunin nito na mas mapataas pa ang antas ng kaalaman ng publiko kaugnay ng epilepsy. Batay kasi sa mga pag-aaral, ang sakit na ito ay maaaring makapagdulot ng adverse psychosocial at emotional effects at disability. Kaya dapat nating maunawaan kung ano nga ba ang epilepsy sa tulong ng mga expert. Doctors on TV.
And because mga kasama, September 1 to 7 is National Epilepsy Awareness Week, we've invited experts from neurology to join us this morning. Our first guest is a child neurologist and pediatric epileptologist. She's the director of the National Epilepsy Awareness Week, Philippine League Against Epilepsy, a diplomate of the Philippine Pediatric Society, and a fellow of the Philippine Neurological Association. Please welcome Dr. Cristina M. Cruz-Urbo. Morning, Dr.
Good morning, good morning, good morning.
Thank you for
having
joining
us. Thank you.
First time sa show natin. And of course, first time din sa show natin, ang gwapong-gwapo, tsaka batang-bata. Please welcome Dr. Marc Laurence Fernandez. He is an adult naman, neurologist and adult epileptologist. He is also a member of Philippine Neurological Association of the Philippine Medical Association. Also a Philippine League Against Epilepsy and Movement Disorder Society of the Philippines.
Morning,
Good morning, Dr. Marc.
Thank you for having us.
Yes. May isang linggo talaga pala na Epilepsy Awareness Week.
Yes,
Wow.
every first week of September, we celebrate the Epilepsy Awareness Week. It is our gift to our patients and to their caregivers para we empower the caregivers and we inform them, we educate them what is epilepsy, mga facts and fallacies, and treatment options. And para alam nila kung what they will do in cases of mga patients with epilepsy.
Siguro we'll start with the definition, Dr. Ano ba ang epilepsy? Ano bang katumbas ng Tagalog din sa epilepsy?
Actually, walang katumbas sa Tagalog sa epilepsy.
Epilepsy talaga.
Okay, epilepsy lang talaga.
Yung epilepsy po kasi ay sa ibang lingwahe kasi marami siyang ibig sabihin din. Pero dito sa Philippines, we have a very florid language. Marami tayong tinatawag sa epilepsy. Pangingisay, pagkatulala, ganyan, etc. Depende sa symptoms na pinapakita. But kung ano nga talaga yung epilepsy, it is a disease of the brain that has an enduring predisposition to cause seizures, epilepsy seizures. So ang ibig sabihin po nito, parang pwede pa magkaroon ng mga atake ng seizures. So there is a predisposition.
So ang seizure tsaka epilepsy, magkaiba yun. Ang seizure, yung
The
manifestation
seizure is the symptom of
Okay.
the epilepsy. When you have 2 or more seizures separated 24 hours apart, then that's what you call epilepsy already.
May na-mention si Doc earlier, ha? Yung isa is pangingisay. No?
Yes.
Ang tawag natin dito sa Philippine dialect. Yung isa naman, pagkatulala. Yung pagkakaalam ng karamihan, nag-epilepsy lang talaga, yung nangingisay Doc, ano tong pagkakatulala? Ang dami nating kilalang laging tulala. Ito may epilepsy?
Actually, iba-iba po kasi yung mga signs and symptoms ng seizures, how they manifest. For example, yung pangingisay, that's what we call yung mga focal seizures or yung mga generalized tonic-clonic seizures. If we say generalized tonic-clonic seizures, there are motor movements of the body. Meron din, halimbawa, mag-start sa isang part ng body, which is focal, then mag-generalize siya.
Okay.
On the other hand, may mga ibang klase naman ng mga seizures na yung mga absence seizures, sila yung mga natutulala. Although marami, at one point in our lives, natutulala naman tayo parati, di ba? Pero there is a parang a correlate to that. If you do examination, EEG, there is an EEG correlate or electroencephalographic correlate to that kind of event po.
May concern ako sa mga bata.
Ayan, kasi mostly bata yata yung mga nagkaka-epilepsy.
Doktora,
Yes po.
may mga kabataan na nung earlier nila sa school, earlier years sa school, they're performing very well.
Yes, yes.
Now later on, nagrereklamo yung mga teachers kasi hindi nakikinig.
Yes.
Or wala lang pakialam. Minsan nakatingin lang sa na parang hindi nakakaintindi. Matatalino, pero bumabagsak yung kanilang grades, doktora. Is it possible na ito ay epilepsy na pala, epileptic
Yes,
attack?
it's a possibility that it is an absence seizure, no? An absence seizure is a type of a generalized seizure na ang manifestation niya, hindi yung alam natin na nangingisay, natataas ang mata na mangingitim. Ito yung mga brief pauses, brief loss of awareness, tapos sometimes mag-eye blinks lang sila, tapos minsan titingin lang sa taas na ganyan, tapos merong oral automatisms na ganun lang, tapos sandali lang yon, few seconds, tapos ang tingin ng teacher, hindi sila nakikinig, nagde-daydream sila. Pero if you will have them on video EEG monitoring, makikita mo, tuwing gaganon sila, magpo-pause, mawawalan ng awareness, merong equivalent na EEG signature na makikita natin. Yun ang absence seizure.
Dapat aware yung mga teachers natin, no?
Yes.
Baka sila maka-identify na yung isang bata ay
Correct.
may
Yes.
epilepsy na
Yes.
pala.
Oh, especially sa mga public schools, sa mga
Yes.
teachers, please, wag naman nating pagalitan yung mga
Yes,
bata na nagaganyan, ano?
That's why we also do the epilepsy school caravan. Now, we go to public schools and private and public schools, and we teach them, the students and the teachers, on how to identify seizures.
Okay. Sino bang nagkaka-seizures at bakit nagkakaroon ng ganitong sintomas?
Lahat po ng may brain pwedeng mag-seizure. So, the most important risk factor is any person who has a brain. So, everybody has a brain. Everybody can have seizures from the neonatal period up to the geriatric period.
May naririnig tayo, no? Sa mga matatanda na, uy, yung nanay niyan kasi nagka-seizure nung maliit eh. Yung lola niya may epilepsy. Kaya dapat yung mga anak niyo, babantayan niyo. Doktora, mas mataas ba ang predisposition ng mga taong merong history sa family?
Yes, kung merong predisposition ng family, bawa merong mga ninuno, kung mga kamag-anak na may epilepsy, risk factor yon for having seizures.
So, genetic history is a
Yes,
risk factor
yes,
for
yes.
epilepsy. Any other risk factors?
Marami. For example, sa pediatric muna, no?
Okay.
Sa pediatric, from baby, pagsimula pa lang ng pag-conceive ng patient, sa tiyan pa lang ng nanay.
Okay.
Any insult occurring from the time of conception up to time of birth, meaning any insult, fever, infection, exposure to radiation, exposure to toxic materials, can cause a problem in the development of the brain.
Okay.
However, minsan din may genetic predisposition din naman na hindi maganda yung history ng family, no? In terms of yung medical seizures sila, pwede sila talagang magkaroon ng seizures. That's just for neonatal period. Pero habang tumatanda sila, habang lumalaki, per age group, merong kanyang mas common type of seizure occurring per age group. So, hindi lang isang klase, marami pang klase.
Sa adult
For
naman.
example, sa adults, usually kasi sa pediatric population, it's more of mga syndromic minsan. Pero sa adult population, the most common cause for having epilepsy, yung pagkakaroon ng previous history ng stroke. Some of the patients, for example, depende sa size and location ng stroke natin. If it is cortical, kung nakikita yung parang dun sa parang surface ng brain, there is a probability for having epilepsy. About 70% or 60 to 70% of adult population na nagkaroon ng seizures would be attributed to a previous history of stroke. Tapos yung mga post-stroke seizures na yan, usually it would happen within the next 3 months, within the next 2 years. Other kinds of causes, tumor, depende rin sa location
Brain
ng tumor,
tumor.
yung mga brain
Okay.
tumor, and yung mga remote symptomatic types, let's say nagkaroon siya ng meningitis in the past, ganyan, then nagkaroon ng parang gliosis, parang nagkaroon ng, should we say, parang peklat, parang pilat doon sa brain, so that would also cause yung pinanggagalingan ng mga seizures natin.
Ano nangyayari sa brain? Parang
Pag
abnormal
nasi-seizure,
discharge ng...
Ang brain kasi kapag nagsi-seizure, hyper-excitable siya. Parang sobrang excited yung neuron. No? So, to the point na mataas ang metabolic rate ng brain, to the point na minsan, karamihan may motor manifestations tayo sa mga patients. No? So, depende on the location of the ictus o kung saan nanggagaling yung abnormal electrical conduction, depende sa pag-propagate, yung pag-spread ng electrical discharge, kung anong itsura ng patient. No? We have generalized seizures, meaning yung ictus sa brain, iba-ibang site nagkakaroon, pero mabilis at sabay-sabay mag-fire no, ng electrical discharge. So, ang itsura niya, pwede yung alam natin, yung pinaka-common na yung gramal seizure, yung generalized tonic-clonic, yun yung pinaka-alam natin kasi yun yung pinaka-dramatic. No? May iba naman, isang side lang ng brain. Pwedeng dun lang siya sa side na yun. So, it depends on what lobe of the brain is affected. Sometimes it stays there, sometimes it spreads out. So it depends on what lobe of the brain is affected. For example, pag frontal lobe epilepsy, for example, sa harapan lang, no? So it will be motor manifestation or behavioral
Are
manifestation.
there any things that trigger seizures? If you eat certain foods, do certain activities, or it just happens anytime talaga?
It would happen, walang pinipiling oras kung minsan.
Walang trigger, it's not because of something you did or ate?
Walang minsan, kadalasan walang trigger siya. However, in some types of epilepsy, halimbawa yung mga photosensitive types of epilepsy, ganyan. There was one incident in Japan before, nanood ng isang show, then blinking lights, ganyan. Many patients, many children were brought to the hospital.
3,000 plus
Yes,
Yeah.
around
Kids
mga...
simultaneous
Yes,
seizures
simultaneous.
after watching Pokemon.
Yes, yes,
Pokemon
yes.
seizure.
It was in
Because of the
1997.
rapid flashing of lights of the
Yes.
television show.
Photosensitive.
Sensitivity.
Yes, yes.
Sensitive.
Wow!
Then, meron din yung sa pediatric din yung mga, I think yung mga juvenile myoclonic
Yes.
din na pag halimbawa napupuyat kung minsan, ganyan po.
Kaya
So,
pag sinasabi
magpupuyat.
namin, kapag may epilepsy ka, iwasan magpuyat, iwasan magpagod. Hindi man yung pagod na maglilinis ng bahay, pwedeng sobrang hihingalin ka.
Okay.
Kasi may mga syndromes na pwede makapag-elicit ng seizure kung pagod, pagpuyat, paggutom. Yun, pwede yun.